Cleaner, my alcohol, my gauze, my needle, and my gloves, right? So we're just gonna say I got my order, I washed my hands with the hand sanitizer, I checked the chart, I'm good, and now I'm gonna come see the patient. So I'm here to see Ms. Dos Santos. She gave me her date of birth. We checked the medical record number, that's all good. So I'm here to draw some blood today. I told them how a lot of times people say they already had blood drawn today. And you're like, no, I'm here to draw a different kind of blood. So I need to take some blood from your artery today because it's gonna check your breathing and your oxygen. Have you ever had that done before? Okay. It's gonna be a little different from a regular blood draw that you get all the time because I have to take blood from your artery, which is gonna come from right here in your arm. So I'm gonna feel first for your pulse. So I get my gloves on. Don't seem like larges. So I might reposition her hand. You can put a towel under here sometimes if you need to help it. I can usually just do it with my own. So I'm gonna feel for the pulse. Now I'm gonna go, okay, I'm gonna check to make sure you have good circulation to your hands. So I'm gonna compress right here on the other side. And can you make a fist for me and open and close it a couple times? Okay, open it. And then I'm gonna let off because we're gonna make sure we have collateral blood flow, and we do. Now I'll let off my radial artery. And if we did not have collateral circulation, what would we do? Stop. Check the other hand. That would be a good idea. What else do you need to check for? Can you draw out of every arm every time?
No.
No? How would you know?
They would have a sign.
Hopefully have a sign, right? Okay. So we know we're good now. So I'm gonna go ahead. I'm gonna clean the site, and then while that's drying, I can get my things together. Some people had asked about that. So, because we don't clean and then dry with a towel, we just clean. So Ms. Dos Santos has a bracelet on, so I would just say I'm gonna move this out of the way, and I'm gonna put some alcohol here to clean off your skin. Okay, we're gonna let that dry for a minute. Now, my little tip is take this and put it here in my non-dominant hand. So it's ready for you. Everybody's gonna be a little different. No. We're not drawing. No, we're not drawing. So I would want to make sure. Yeah.
I can really feel it.
There goes your pulse now.
Really feel it now.
Woo! In term 2, they draw from each other.
Oh, okay.
So
So
today
how
they're
did
just
you do
practicing.
it?
Yeah.
Okay.
This is the very first time they're learning about how to do
Because
this.
I know
Yeah.
people were like, can I draw blood right now?
So now we would need to make sure we take the cap off, but not have that orange part, which is important. I mean, I'm just going to show you. I'm not going to do it. So we would take this off, and then I'm going to look for the bevel, and then I have to make sure that this is not in the way, because a lot of times that'll be on that side, and then you're going to have to recap it and move it, which is not ideal. But we'll put this back on. Don't ever do that, okay? So I'm going to make sure this is out of my way. So that's ready to go. Then the last thing I want to do is make sure my Band-Aid is ready to go. So I'm going to do this and put it here. So now once I'm done, I have my gauze ready and my Band-Aid ready. Big mistake, students, like they take the needle out and then they got like, put pressure on it. You gotta have everything ready because as soon as you take that out, you need to put pressure on it, okay? So now I'm ready to draw, so I'm gonna make sure my arm is how I want it. I'm gonna feel. I'm gonna go ahead and let her know. Okay, you're gonna feel a big poke. Please don't move. Okay, so it's in, and I see her.
Ow!
Oh my gosh, silly. I did that to them in the back. So I put the needle in, and I'm getting blood. But remember, the other thing that happens, if you see a flash and it stops, it means you went too far. So normally you'll just want to pull back a little. So I'm getting blood. I'm all filled up. So, okay, I'm going to take the needle out, immediately put my gauze on. I will take this and put the orange cap, immediately never put a needle uncovered down, okay? And then I'm going to watch. Okay, she's not bleeding. We're good. Then my Band-Aid's right there. Take it, put it on, put it down. I usually put a little pressure on it because we want to make sure it stops bleeding. I'm going to usually do this a little bit or do this a little bit. put the cap on it like we talked about, so we would take this off, put this on, do that, put it in our bag, and then what information do we need to let the lab know?
Label, patient label.
Patient label, what do we need to tell them?
If they have a temperature.
Time, temperature, medical record number, name, what else do they need to know?
If they're on oxygen.
If they were on, whatever they're on, the ventilator, the oxygen, breathing treatment, whatever it might be, you gotta put the settings on there. So we'll know that for making adjustments. Okay? Who has questions?
I have a question.
Yes?
Have you had someone pass out on you while you were doing it and they were like,
When I first started here, I had 2 students that
I've had students,
Yeah.
patients usually just get mad and upset.
not like a patient when you were
Well, they're
doing
in a bed, so it's not bad. Some students pass out the first time.
usually they're on a ventilator, so they're not gonna
Yeah.
stop breathing.
They're gonna keep breathing, it's fine.